Hi, what does thyroid hormone have to do with weight loss? I'm Dr. Brian Prax, and you expressed interest in our weight loss program. The purpose of these emails and videos is to give you important information that can help you achieve your health goals faster. With regard to weight loss, or weight optimization as I like to call it, and other chronic conditions, most people have what we call a web of physiological dysfunction. And just like a spider's web, it doesn't just have one strand or two strands, it has a multitude of strands that lead to a person's issue. So today we're going to talk about your web of physiological dysfunction called weight loss and thyroid. So with regard to thyroid, if you've ever noticed muscle cramping or muscle spasms, abnormal sweating at unusual times, feeling of being tired or fatigued or even chronic fatigue, cold extremities, hands, feet, legs, arms, things like that, then you may have a thyroid problem. Now most people that I interview and work with regard to weight loss will often say, I've been checked for thyroid, my doctor said it's normal. What we want to talk about is thyroid with regard to normal findings versus optimal findings. There was a study done recently, it's actually an ongoing study called the Framingham study. And it looked at multiple things with regard to health. But one of the things that they found is that normal is not the same as optimal, especially with regard to the thyroid. So let me explain. Normal lab readings for thyroid, we're talking the thyroid stimulating hormone, which is the study that they do, is anywhere between 0.45 and 4.50. And what the Framingham study said, and I agree, is that this lab range is way too large. What we need to do is we need to figure out not what's normal, which is the average person who gets their blood test done, but what is the optimal range of thyroid stimulating hormone and all the other components of blood. So the optimal range, it turns out, is a much tighter range, and that's going to be somewhere between 1.8 and 3.0. So this is optimal and this is normal. I'm telling you, you want to be in the optimal range. We want to make sure that thyroid stimulating hormone is in the normal range. So with regard to your web of physiological dysfunction, in future videos we're going to go through and talk about many of the other components that may be holding you back from losing weight and keeping it off. And I know a lot of folks have gone through this program and that program and another program and Weight Watchers and cutting out fat and high carb, low fat and all that. And a lot of us have been on this roller coaster of what we call the yo-yo syndrome. It may very well be that you've got an issue with the thyroid. With regard to the thyroid, it's more like a puzzle, except thyroid is a 10-piece puzzle, yet doctors are just looking at one piece. There's other things and components we need to look at, and some of those components would be T3, T4, reverse T3. We also need to take a look and see if the immune system might be attacking the thyroid gland itself. So with those components, if we think there's a thyroid component as being a part of your web, then we need to look at the 10 or so components of thyroid itself, of the thyroid gland. Also remember that the thyroid gland is here. It's being controlled by the pituitary gland, which is another hormone, the master controlling hormone, which is actually being controlled by the hypothalamus, which is being controlled by other areas of the brain. So there's more to it than just thyroid stimulating hormone. If this is sounding interesting, what I would encourage you to do, or invite you to do, would be to call my office. Our phone number here is 434-977-5433, or you can email me, patientrelations@chiroprax.com. Call up or email and ask when is our next free workshop on weight loss. You also may want to call and ask for a free consultation to see if we may be able to help you out with your weight loss program. So don't start another program, don't go on a crazy diet, a fad diet, or anything like that before we take a look at your web of physiological dysfunction. I want to leave you with one last thing, and that's a story. And it's a story of a woman named Krista. And Krista joined the weight loss program. She originally joined because she needed to lose weight. We started to investigate and found that of the web of dysfunction, the thyroid was a major component. She had a disease called Graves' disease. And what we found is by supporting this thyroid gland, which started to produce the proper amount of thyroid hormone, balanced it out, helped the metabolism, and she just about effortlessly lost 23 pounds in 4 months. Amazingly enough, other side effects were that her tingling and numbness of her extremities vanished. The high blood pressure, of which she was taking 1 or 2 medications for, normalized. The tingling, the numbness, she was taking medication for that, normalized. No more need for that medication. Her fingernails started to strengthen up and even grow faster. And a whole bunch of other components began to occur. So in doing this, we found out that her body could normalize, but we first had to look at her web of physiological dysfunction. I want to thank you for your time. I look forward to helping you optimize your weight for the rest of your life, and I look forward to helping you achieve your health goals faster.